Thank you, Nolan, or as we refer to you, friend of Liv. Our next speaker is the Division Chief of EMS with the Crawfordsville Fire Department. He holds an associate degree in fire science technology and began his fire service career in 1996. He's here to share with us his paramedicine program. So let's welcome Paul Miller to the stage.
Thank you. It's a real honor to be here representing the fire department and paramedicine for the state of Indiana. I got to tell you, I was a little under the weather today, so I sure wasn't too sure how this was going to go and if I was going to be able to participate. But, being a smaller, more intimate kind of setting, I figured this would be okay. So what we're about at the fire department is really inspiring change and making opportunities outside of what's been traditionally thought of fire service approach to care. So with so many great speakers that were already here ahead of us today, I kind of wanted to bring a story of inspiration. This is a really remarkable young woman that's very dedicated and driven and strong. The likes that I really hadn't seen in my 20-year career with the fire service. So a little background, and this is a good look at a lot of the moms we're seeing in community paramedicine delivering care through Project Swaddle. So this young female in her 20s has many of the disparities that we've talked about here today. Nearing the second trimester with no prenatal care, a long diagnosis of mental health issues, depression and anxiety, a long list of substance use disorders, starting as early as age 13 with marijuana, really evolving through prescription drugs and illicit drugs, and a long history of domestic violence. Now, this young woman has dealt with physical and emotional violence throughout her entire life. That's made it very difficult for her to be successful. And everything we're talking about with the social disparities, housing insecurities, food insecurities, this isn't right for a civilized country or for any one of our moms that are the most vulnerable. So that's a little background on our history. We already know the public health crisis ahead of us. But as a firefighter, a father, a foster parent, and a newly adoptive parent, the thing that stands out to me the most in this slide is the number of children that are living in unprotected homes. It's scary. I've been a coach. I have 5 children, and to know a lot of their friends and their families are living in these environments that are unsafe for them is heartbreaking. So in Montgomery County, we're not immune from it. Being in a rural community, I think we're more vulnerable. And we're seeing a lot of the things. While we're not the worst in the state, we're going to make sure that we're never there, and we're a part of the State Department of Health and the governor's plan to make sure that we're the top in the Midwest of providing healthy and safe homes for our families. But we were seeing smoking rates off the charts. 23% of our moms in our community are smoking while they're pregnant. So these are not going to lead to good health outcomes. At our fire department and our community, with the number of supports that we have, we've been able to put in place a lot of healthcare initiatives to provide true wraparound services for our community, starting at the beginning of life all the way through helping our seniors age in place. Project Swaddle, obviously, everyone loves babies and they have a heart for it. It's easy to wrap your heads around and getting a lot of support for these moms and their families. So what is Project Swaddle? Project Swaddle is a community paramedicine program. It's a fire-based program that delivers home services to the clinical and socially high-risk moms in our community. We work as physician extenders, so we're not off there building our own care plans. We're under the direction of nurses and physicians that are able to put in place good plans of care. And we're there to address not only the social and health disparities, but create shared value for our community, have an economic look into this, and ensure that there is a safe home environment. And it's the best way to ensure that is being in their environment and really delivering a high level of patient-centered care. So this is our community paramedicine team, and this is really the boots on the ground that makes the difference for our community. It's a group of ACO nurses and physicians and fire department paramedics that go out and deliver these services. The bottom's kind of a shameless plug. I was really proud to just be a part of this. Our medical director that oversees Project Swaddle received Medical Director of the Year for his guidance and leadership in the project. And our community paramedic that leads this initiative is over there with him as well, who received Paramedic of the Year. And we're very proud of him. So for the nurses and the physicians in the room, you get the triple aim. And this allows us to meet the patients where they're at and really affect that, delivering the right care at the right time at the right place. It's a very cost-effective program, and it is built with the hopes of creating true healthcare reform that we can really reduce the cost of care while expanding access to care at the same time. The big thing that this is not, and we've really embraced this, and we've had good support from the Nurses Association here, is that this isn't a replacement of nurses. This is really just to fill the gaps in care, and that's why we align so well with our nursing partners and our physicians to make sure that we're delivering the highest level of care. We partner in our community with the Nurse Family Partnership, so we have good working relationships all the way around, and this is vetted to make sure that there is no duplication. And because of the leadership at the state level with Representative Tim Brown, he has licensed us, and that's allowed us an opportunity to really look at delivering care in the preventative place instead of waiting until an acute accident or a 911 call in order to affect families. So it's really innovative how this works. Because of our leadership at the hospital, we're able to start visits as early as 8 weeks in some cases. Our goal was at 12 weeks. When we first started looking at developing this program, we had a lot of high-risk moms not even receiving any kind of care until 16 to 20 weeks when they were going to the Women's Resource Center to get an ultrasound or a pregnancy test. We look at delivering care as early as we can in the first trimester, all the way to 12 to 16 weeks postpartum. Each individualized plan is different based on their needs. So whether we're looking at a clinically high risk, someone on bed rest, and delivering McKenna injections in the home and doing the labs, or it's dealing with moms that have different substance use disorders, these plans will vary. I don't want to hold you from lunch, and there's been a lot of talk about the social determinants of health, but by being in the home, being a part of the care continuum, and documenting the way we do within EPIC, and allowing all practitioners to see what kind of care is being delivered in the home really affects a lot of these. And it's able to put more social services in place early to make sure that the handoffs are seamless. So some of the non-traditional things that our fire department's able to deliver because of our Franciscan partners and our nursing partners is really amazing. We've always had a passion to delivering care to newborns in our community. We started a car seat program back in 2003. The head of our car seat program and now the head of our community paramedic program is also a county coroner. Both of us have seen too many dead babies, had to hold them. He's carried them through their autopsies and stuff like that. We couldn't allow this to happen. Our car seat program evolved, then into DOSE with Safe Sleep, and now community paramedicine delivering prenatal and postpartum care for our families. We felt it was really important that we're putting full wraparound services in place for our families. And on top of that, the education and brief action planning, which is kind of non-traditional for any fire department. In fact, we're the first fire department in the country to receive certification in that. Our paramedic is also the first in the country to be MOZ certified, milk mob certified. So you can imagine the looks when we walk into a room. But we're serious about what we're doing. We're not just trying to throw together an empty game plan. We're putting a lot of research into this to make sure we are delivering the highest level of care for our families. The support services that we have in place that makes our program so good and progressive is because of the nursing partners at the Women's Resource Center. It's because of Franciscan Hospital. It's because of the state and county health departments that's really educating us on what our true community needs are. And then, obviously, I don't have an MBA. I don't have a background in data and analytics, but my partners at Purdue University do. And they're able to make sure that the metrics and measures are going to be in place to make this an evidence-based program. So, additional services that we're able to do, and it's something that firefighters just get, is we're accessible 24/7. My community paramedic is always on call, and he's not asking for extra pay. He's doing it because it's the right thing to do. And that should be the expectation of everybody in this room, is to have services in place for them by their public servants that meet and manage the needs when you need them and want us to call. We have an excellent relationship when we're talking about additional services with Baby and Me Tobacco Free. That's not a traditional service you see many fire departments involved with, but we are. It provides additional supports and incentives to our moms to be successful long term. And the whole vision behind creating shared value and economic development is because healthier communities are higher earning communities. People and businesses are attracted to live and grow in the communities, and we're a part of that, and we want to see that through. So this is how we have endless opportunities. One of the largest faith-based systems in Indiana puts so many resources behind us and supports that allows us to train in so many non-traditional areas that paramedics haven't seen before. It's having full access into the EMRs of the physicians and nurses and specialty cares. So we're really proud of this, and it makes it really unique. Now, getting back to the story and the history that I started with, the story of inspiration, a lot of recognition was gained on this program from the mom I spoke to earlier. About 2 weeks into starting our program, I received a phone call from my community paramedic. He says, I need immediate help. He says, one of our newly enrolled moms isn't going to make it through the night. We need to do something. So, a little backstory, this mom had dealt with a domestic violence case the night before. Her boyfriend was arrested, and there was a lot of methamphetamine left in the home, and she used it. She called my paramedic and says, and this really goes to show you what kind of person he is. She calls him and says, you are the only person I trust. You need to help me. You need to get my kid to a safe space. He said, what am I to do? I said, you know what? Go there, take care of her. And that's exactly what he did. He got DCS immediately involved. He got the child to a safe location. He contacted the mental health provider and case manager, and they started a team approach on this. We started beating down the phones, looking for a safe place for this lady. And most of you are aware there is not a lot of inpatient facilities readily available to our most vulnerable population and our pregnant moms. Our medical director was on board getting her an inpatient stay immediately at his hospital. Had Martha Allen, Dr. Box, Dr. Walthall, all working to make sure that this mom was placed. Volunteers of America stepped up. We met this mom after a long, long weekend of in and outs, her fleeing, not knowing what to do, until we could get her placed successfully, which we thought. She checked herself out 2 days after being in Indianapolis, I believe in the Rubin Engagement Center, and started hitchhiking. She was lost for about 2 days, and thought we had a huge failure. We really dropped the ball when she was reaching out to us. Immediately, she, within 2 days, reached out to our community paramedic and said, I still need help. What am I to do? He worked tirelessly, and I'll show you with the number of phone calls and home visits that he made, was able to get her placed. And I'm very happy to say that she's now in the process of reunifying with her son early. She is 9 months sober. And these are opportunities we can create when we put the teams in place for the right reasons to deliver the right kind of care. Yeah, it's really inspiring. So here's a little picture of what my paramedics are doing every day. We just started delivering care in mid-April, and in that short period of time, 420 phone calls and telehealth visits. We're doing a lot of things, and we just received a Trailblazer grant with Purdue University to make sure that our moms are receiving activity trackers, scales, blood pressure cuffs, iPads, thermometers, and everything that Bluetooths into this device to help manage the cares of the moms in real time. And you can see the quality of life. But all these programs are only successful when we break down silos and agree to truly collaborate and do it for the right reasons. Purdue University, we have Ball State involved, IU School of Health, Franciscan, our community foundation. There are so many partners that go into making this successful. But I do truly feel that this can be replicated anywhere. And we really hope to see that really soon. So that's as quick as I can get through this at a very high level overview of what community paramedicine is and the kind of impacts it's making without holding you from your lunch any further. But the team of nurses, physicians that have championed this for us are here. They're at tables scattered throughout here. A large group of them are at table 24 that are happy to meet with you and really talk about this further. So thank you.